So I decided to do strangulation. This is due to compression and closure of the blood vessels and air passageway due to external pressure on the neck. This causes cerebral hypoxia or anoxia because there's no blood flow to the brain or from the brain to the rest of the body. It only takes about 2 kilograms or 4.5 pounds to stop blood flow in the jugular vein, and only 5 kilograms or 11 pounds of pressure to stop blood flow in the carotid arteries. And it takes substantially more pressure to crush the trachea. It takes 15 kilograms or 33 pounds of pressure. When you alter the cerebral blood flow, this causes the injury or death in most types of situations. It's not actually the lack of airflow, it's the lack of blood flow. Complete blockage of the carotid arteries. When there is a complete blockage of the carotid arteries, it only takes about 10 to 15 seconds to become unconscious. There's actually 3 types of strangulation: hanging, ligature, and manual. Hanging and ligature are pretty common to each other, as in you still use like a rope or some type of other object to put the pressure, but with hanging, you're actually placing it around the neck and lifting and having the weight of the person's body cause the constriction or pressure on the noose. It doesn't have to be a complete body suspension. It just needs to be just enough to close off with those pounds of pressure. So anywhere, like if you don't want to crush the trachea, all you really need is 11 pounds of pressure. Whenever it's hanging strangulation, there's distinct marks on the neck. It makes an inverted V pattern with the base of the V pointing towards the point of suspension. Internal injuries of the neck are rare with hanging strangulations, unless you were doing like a judicial hanging, like back in the Wild West, whenever they would put a noose around your neck and then drop the floor from underneath you and your whole body would drop like 30 feet. Then there was severe soft tissue and cerebral spinal trauma, but usually with hangings, there's not, unless it's judicial punishment, which we don't even do anymore. Petechia can be seen in the eyes and face, but it's rare with hanging strangulation. Ligature strangulation is also with a rope or some other object applying pressure to the neck. So you would have horizontal marks with this because usually the person is behind you holding the pressure, so it holds it as an even level instead of like up. So there's no inverted V. Petechiae is more common in this because somebody holding an object up around your neck, there's not going to be that constant set of pressure, especially if like your victim is struggling. Then you would be letting air in and letting blood flow and then closing it and then letting it flow and closing it, depending on how much stronger you are than your victim or you're not than your victim. Internal injuries of the neck are still very rare with ligature strangulation as well, because there's just not that much force. However, with manual strangulation, this is whenever you actually use your hands to strangle someone, or when somebody strangles you with their hands. This is the most common strangulation used in domestic violence. There's variable amounts of external trauma to the neck. Lots of contusions and abrasions. Usually this is from the assailant on there, leaving like bruising, but also whenever the victim is trying to like claw away their hands, they can end up scratching their own neck, harming themselves, trying to fight that person off. Internal damage is quite severe usually with these, including bruising of deep structures, fractures to the hyoid, trachea, and carotid cartilage, or cricoid cartilage, I'm sorry. And petechia is also common in this as well, because you're going to have that, they're going to be holding pressure, but they're not going to hold the same constant amount of pressure, so they're going to release and let air flow and let blood flow, and then they're going to press it more, and it's going to cut off the blood flow again, and just back and forth until you die, which can actually take 30 to 40 minutes. For treatment, obviously you would try to get that blood flow and airway patent again. So you'd remove whatever object, you'd stabilize that neck in case of injury, and then it would really just be kind of heal and just take care of their pain. They would need psychiatric help, because I'm assuming that either this would be somebody attacking them, or this would be a suicidal attempt with strangulation, or with hanging strangulation, I'm sorry. So, and then you would also want to control their pain because it's going to have bruising, and potentially, depending on which one you have, you could have fractures, and just a lot of support. They will need a support system.